I mentioned before the Juvederm Volbella product is also the perfect product that was originally designed for injecting the lips. Due to its relatively lower HA content, it is a very soft lifting hyaluronic acid filler which perfectly integrates with the surrounding tissue, which is an important property of the material, especially in the lip area, because it is such a motile area that needs a product that perfectly melts and blends into the surrounding structures. We mentioned before that she is happy with the shape of her lips as well as the definition of the vermilion border, but she would like to balance the visible volume of the red part of the lip between upper and lower lip, and this is why I suggest to inject just retromuscularly behind the orbicularis oris muscle in order to better evert the red part of the lip with a direct injection technique. So I go clearly above the red part of the lip, through the muscle, behind the muscle, perpendicularly inject 0.1 cc, which then above the dental line supports the J shape of the orbicularis oris muscle, and by that averting a little bit of the red without changing the natural look of her lip and without over volumizing it. So the next point, it's just creating a little line of little supportive pillars behind the muscle that lay above the dental arc and that give support from inside, that help evert the red of the lip without creating an unnatural overfilled look of the lip. That's what our modern patients like to look like. This overfilled, over-volumized lip look is something that shies them away in some cases from getting the lips injected at all. The other advantage of this technique is clearly and obviously that the white part of the lip is significantly less sensitive, so you don't need to think about anesthetizing the lip. The Juvederm VYCROSS collection contains lidocaine, so the procedure-related pain is perfectly masked by virtue of the injected material, but even the prick of the needle is not painful at all in the white part of the lip. VYCROSS cross-linked Juvederm fillers have the unique property of a very efficient cross-linking, which makes the fillers less prone to swell once they are injected into tissue. That also reduces the risk of undesired swelling after procedure, especially in the lip area. As you can see here, you see a little bit of more visible red in that injected part compared to the other side, without having lost the natural profile of the red of the lip, which gives the lip a perfectly natural look. If I ask her to turn her head now, as I said before, I would always like to check the balance of projection between the upper and the lower lip in order to avoid over projection of the upper lip, because that also gives patients an unnatural look, and in her case it's perfectly fine.